Today we have Acting Secretary of Health, Alison Beam, and Senior Advisor for COVID Response, Lindsay Molden.
Good afternoon, and thank you for joining us. With me today is Senior Advisor for the COVID Response, Lindsay Molden, who will provide an update on the vaccination effort in Pennsylvania. We understand how frustrating it has been for many to get vaccinated. I want Pennsylvanians to know that we have heard you and we are taking bold, decisive action. To ensure there is accountability in the administration of vaccines, effective today, I have ordered vaccine providers to administer at least 80% of the first doses of vaccine they receive within 7 days of delivery. I want to emphasize that this applies to first doses. The Commonwealth has prioritized ensuring second doses in Pennsylvania are secure once the first dose is administered. Vaccine providers should be making that second dose appointment when they administer the first dose. Next, if vaccine providers fail to comply with the terms of the order, they may temporarily have their allocation of first doses reduced. This includes vaccinating people within the phase designated by the Commonwealth and timely reporting responsibilities. We also are narrowing the provider network to get the vaccine to those providers that have demonstrated they have the ability to vaccinate the most people quickly. This means that some providers will not get as many first doses of vaccine as they have in the past. However, this is the most efficient way to get people vaccinated quickly, so we can resume some activities as a community. Pennsylvanians have rightly demanded easier access to appointments. And vaccine providers agree that allowing them to use their systems to schedule appointments for their locations works best. However, using strictly online systems or phone systems that point you to the online system have left out many, including seniors who may not be tech savvy or have access to the internet. Vaccine providers can and must make sure that if they are scheduling appointments, that they make those appointments accessible to all who are eligible. Effective February 19th, vaccine providers must offer appointment scheduling to everyone eligible in Phase 1A, both online and through phone systems that are answered by a person to assist in the scheduling. It is essential that in the process of getting vaccine doses administered as quickly as possible, we are still able to collect vital data in terms of the number of doses administered and who is getting them. In the order I signed today, vaccine providers are reminded of their obligation to report to the department vaccine administrations within 24 hours. We need to know not only how much vaccine has been delivered, but accurately understand how much has been administered. We also need to collect race and ethnicity data to ensure that vulnerable communities and communities of color are being vaccinated. It is our collective responsibility to work together to slow the spread of COVID-19. Vaccine providers are the key to making sure that we can recover as a Commonwealth and as a nation. They have done a tremendous job administering more than 1.5 million doses of vaccine in record time with limited resources. However, there is a structure in place to save lives, and vaccine providers must follow these plans. We continue to work to make sure the limited supply of vaccine is administered equitably and quickly. There is not enough vaccine for everyone who can get it right now, but there will be. And we are working to get as much vaccine as we can into the arms of Pennsylvanians, and we will continue to do more. In the meantime, we must mask up, wash up, and social distance to save lives. I'll turn things over to Lindsay Malden to talk more about our efforts to help Pennsylvanians prepare for their turn to be vaccinated.
Good afternoon, everyone, and thank you, Secretary Beam. Here's today's update on the vaccination effort in Pennsylvania. Vaccine providers are reporting they have administered 1,523,510 doses of vaccine as of this morning to 1,167,402 individuals. This is 82% of the vaccine received for people's first doses in the Commonwealth. In addition, 356,108 people have received both doses and are fully vaccinated. This is 35% of the vaccine we have received for people's second dose. We know that the actual number of people vaccinated is higher, but there are natural lags in reporting because vaccine providers have 24 to 72 hours to report. There are also delays between when the vaccine orders go to the feds and when the vaccine gets delivered to providers in the Commonwealth. For this week, Pennsylvania has been allocated 175,175 doses of vaccine to give people their first dose of vaccine. In addition, Pennsylvania has been allocated 143,275 doses of vaccine this week to give people their second dose of vaccine so they can be fully vaccinated. That makes 318,450 total doses coming into Pennsylvania vaccine providers this week. We have heard a lot of concern from vaccine providers and Pennsylvanians about being able to get the second dose of vaccine. I want to stress to all providers that the second dose of vaccine for your patients is secure. The second dose of vaccine is essential, and we are ensuring that for anyone who gets a first dose today, there will be a second dose delivered to that provider in time for your second appointment. Providers do not have to set aside the vaccine they receive for first doses. We have purposefully included your second dose into our allocation strategy because it is essential that Pennsylvanians are fully vaccinated. Getting vaccinated is such an important step in our efforts to stop COVID-19. This week, you may remember that we launched the Your Turn tool to help everyone understand where they fall in the vaccination prioritization effort. Already, just under 70,000 people have signed up through Your Turn. In addition to finding out when it is your turn to get a vaccine, the Your Turn tool allows people to register to receive updates about vaccine distribution in their local community and allows the department to let you know when it is your turn to get vaccinated. We recognize that what defines a registration system might be different from person to person. So I want to clarify that the Your Turn tool is a tool that allows individuals to identify their status within the vaccination prioritization phases. It also allows for individuals to submit their email address to receive future updates related to vaccine opportunities when there is more vaccine available. Your Turn does not schedule people for a vaccine appointment. However, if it is your turn, you will be directed on how to find a vaccine provider. If someone does not have access to the internet to use the Your Turn tool, they can call 877-PA-HEALTH to speak with a representative to determine eligibility. If eligible, the representative will help the individual find a vaccine provider near them and provide contact information to make an appointment. As Secretary Bean noted, we must have patience as the amount of vaccine available in Pennsylvania and across the nation is extremely limited. Vaccine is being provided to tens of thousands of Pennsylvanians every day. And as Secretary Beam said, we are working hard to increase vaccinations. While we continue to vaccinate people in Phase 1A, we must keep up our efforts to stop the spread of COVID-19 by masking up, washing up, and maintaining social distancing. Thank you. I'll now turn the microphone back to Secretary Beam, and we'll take questions.
First up for questions today is Chris Mamula from the Pittsburgh Post-Gazette. Chris, go ahead and unmute.
Thank you. Thank you, Secretary, for being available today. I appreciate it. I'm wondering how the department was going to go about narrowing the number of vaccine providers.
Yeah, so we worked diligently over the last few weeks to orient ourselves in the full provider network because we really have adopted a policy of inclusivity to date, and we have over 1,700 providers who have stepped up and really enrolled to stand with us in vaccinating Pennsylvanians. With the limited number of vaccines that Lindsay went over and I reiterated, we need to make sure that we focus in on the providers that are able to reach the communities quickly. In that, we found that our hospitals and our health systems, our FQHCs, our county and municipal health departments, and our independent pharmacists have had demonstrated experience with their ability to move quickly and effectively pushing first doses into the community. And so we've focused our allocation on making sure that doses are concentrated to those types of providers.
So, it sounds as though that those are the same organizations that currently get the vaccine: hospitals, health systems, federally qualified health clinics, county health departments, and pharmacists. I mean, I don't see any difference.
So previously, when we were actually administering the allocations, there were many other provider types that were receiving vaccines. Those were primary care physician offices. We even had different types of small provider offices receiving vaccine. That worked to fulfill our initial mission, which was having healthcare workers vaccinated. As you know, healthcare personnel are in phase 1A. But now that those staff of those facilities have been vaccinated, we really want to hone in on having those allocations go to those remaining 4 providers. Our previous allocations were much more diverse in nature, and so we're narrowing in on those 4.
Next up, Victoria Lucas from Fox 43. Go ahead, Victoria, and unmute.
Yes, hello, and thank you for allowing us to be here today. So my question is just to piggyback on the recent weather conditions that we have had. I know that the recent weather conditions have slowed down distribution of the COVID-19 vaccine, and is there any update on that?
So the weather has been a challenge, and we've heard from different providers how that impacts scheduling mechanisms and making sure that we use our first doses as effectively as possible. Luckily, what we've also seen is the flexibility and the nimbleness of our strategy really play out in that folks have been able to pivot and use those doses as quickly as possible once the weather allowed for it. We have heard from different partners that it has meant a slight delay, 1 to 2 days of a delay of the dose, but nonetheless, they've risen to the challenge and been able to really allow those doses to still get into arms relatively timely.
Thank you so much.
Next up, Deanna Durante from NBC 10. Deanna, go ahead and unmute.
Good afternoon. You had said that you're hearing from your providers that they prefer to use their own scheduling systems, but we also know that we have had a delegation from Chester County and Montgomery County write to you and request just the opposite. And just this week, a vaccination clinic was held in a Norristown hospital, and their phone system crashed within 10 minutes of trying to register people. And they're advocating for a centralized registration system, as well as the Montgomery County Health Department. So who are these providers that say, yes, we're happy to do it this way, and why not just offer some sort of way for the rest of the folks to get this on a centralized system?
Sure, I'll start, and then Senior Advisor Malden, maybe if you want to chime in. What we've been able to learn is where there are providers that have invested in their own technology, their own scheduling systems, their own operability with their existing electronic health record system has been key to them because they want to make sure that folks are getting care even after that vaccine. And so we have heard a preference from providers to not be duplicative in putting out additional software. Providers have invested, and where they have invested, we should allow them to utilize that technology. But I think what Lindsay will likely speak to is we are in a culture of continuous improvement. And so we are ever improving our ability to be responsive to the requests of other stakeholders who may want more technology in this space.
Yeah, the only thing I would add to that is that we have, of the 70,000 folks who have signed up for Your Turn, over 80% of those folks are currently eligible. So we recognize that the system has been useful for them and that they want to hear back from the department. And so we're working with our partnerships, like Secretary Beam said, to kind of understand how we can communicate to these folks moving forward and get them the most efficient information as possible.
And one more question. So if the goal here is to give more vaccine to the providers who can push it out faster, places like Chester County, Bucks County, Montgomery County can all do thousands of people per day, but yet their increased allocation is not reflecting those numbers. It's still going to a number of facilities that can only do dozens per day. Why not give them even more?
So we have been in active discussion with a lot of those counties, making sure that they understand that first is always the county allocation. Understanding what each of the 66 counties that we're responsible for get by way of an allocation each week is always our first step. Within that, there are true partnerships that have emerged with county municipal health departments and hospital systems and other provider partners to really capitalize on infrastructure that both the counties and the providers have invested in. And I think those are some of the best partnerships and most successful partnerships that we've seen. And so we really see this as an opportunity to allow them to align further and have the high throughput, which the urgency of this crisis demands.
Next up is David Wenner from Penn Live. David, go ahead and unmute.
Hearing.
David, go ahead and give it one more try.
Are you hearing me, Allison?
We hear you now.
Okay. Allison, you mentioned earlier that 1,700 providers under the new course that you announced today. What will that number be?
1,700 providers have really risen to the challenge and volunteered to be enrolled to be a vaccine provider. It's a much smaller amount that are even currently receiving vaccine. We know that there are going to be opportunities to grow that network at a future date. But this week, we have narrowed that to much less, closer to around 200 to 300 providers will be actually being able to avail themselves of the vaccine as we move forward in this narrowing of the provider network.
Okay, and my second question, you explained that, if I understood correctly, you explained that providers will be expected to schedule the people who reach out to them. Does that mean that they are expected to just be able to have a person to talk to and schedule an appointment to whoever asks for an appointment, regardless of how far out that appointment might be?
So this order really is responsive to what we've been hearing by way of frustration with scheduling systems broadly. We want to make sure that it's not just an online system or a phone line that you call that guides you to an online system. We want to make sure that the phone line is staffed by real, live individuals that will be able to take your information and schedule an appointment for you. And likewise, honing in on the importance of that second dose and the scheduling of the second dose, that should be happening simultaneous to that first appointment. And so what this order requires is that vaccine providers not only have that online technology, which a lot of them already have, but really invest in making sure that the phone lines are there for those that aren't as comfortable using the online reporting mechanisms.
Next up is Daniel Hamburg from ABC 27. Daniel, go ahead and unmute yourself.
Hi, so quick two-parter here. First, can you respond to the calls from many education organizations to get teachers vaccinated? And we're also hearing that some teachers, even though they're technically in 1B, have already started to try to get vaccines now.
Absolutely. So one of the stakeholder groups that we've been actively communicating with are all of the school-based stakeholders, the education field. With my counterpart who oversees the Secretary of Education, we've been in very close contact with not only leadership, but also the educators to hear the concerns and the understanding that they want to be vaccinated as well. We hear them and we understand that. We also know that at this stage, the federal government has teachers in phase 1B, and so we are not shifting them up to phase 1A. We want to make sure that our educators know that they are a valued front line in their own right during this COVID response, and we want to make sure they get vaccinated as quickly as possible. But at this stage, we are still conforming to the federal guidance, which has them in 1B. As for the non-compliance, this order addresses that by also indicating that the providers have to comply with the Commonwealth's phases. We want to make sure there is clarity in phase 1A being what is existing in the Commonwealth right now, and so to the extent that a provider would jump into a later phase, they could see a future allocation be tapered respectfully of that behavior.
Thank you.
Next up, Jim Melwert from KYW News Radio. Jim, go ahead and unmute.
I talked to several community level providers, more pharmacy sized providers, and the ones that I've talked to have said a centralized scheduling system would be a huge help for them to take that scheduling component off their shoulders. But it sounds like this plan is going to put more pressure on them with the added scheduling and reporting components. Are you worried you squeeze them out and end up only with the larger centralized hospitals or healthcare systems?
So we've been able to talk to a lot of the pharmacists and others that are different in the hospital facility type delivery of how they work with it within the healthcare system. And many of them also have actually had their own scheduling system that they also have invested in. But this is also why the Commonwealth has invested in a system such as PrepMod to make sure that there is a tool available to providers who want to use that. And so I think it's allowing a bit of autonomy where the providers have already invested in a system that is most compatible for them and their patients, but then also providing an alternative for those that need to have some sort of scheduling system.
And I'll take one for the team here and ask a question that keeps popping up in the chat. You mentioned the 200 to 300 figure. Is that happening? Can we expect to see that this week? Is that filtering down over the next couple of weeks? When is that actually happening?
So this order is indicative of a plan, and it will progressively come into effect. And so we're making sure that first, next week, providers are focused on data reporting. We are doubling down on our data reporting requirements that are already in place to make sure that they know what our expectations are so that we have the data of integrity to inform our decisions. They will also be looking at making sure that their phone and online scheduling capabilities are in accordance with the order, meaning that they actually have the investment in the resources and the staff to man those phone lines. Following that, we will be able to have the allocations reflective of their compliance with the order. It's important from our perspective that our partners, our providers, know what our expectations are before they place their next order. So as they place their orders next week, they need to know what our expectations are so that they can tailor them or adjust them reflective of what we expect by way of not only general compliance, but also volume. And so throughout the next week is when this will actually come into play. It's a progressive plan for compliance.
Next up, Nicole Brambilla from Lancaster Newspapers. Nicole, go ahead and unmute.
Thank you, Secretary, for taking my question. How, practically speaking, is the Department of Health going to know if there's compliance or not? I ask because one pharmacy, and this was obviously before your order, when I spoke to them, they were vaccinating educators in 1B, and he said, quite frankly, that he didn't even know who was in 1A. So are you reliant on people communicating that directly with the Department of Health, or how practically do you foresee that working its way out?
So we communicate with our providers routinely, making sure that they know if there is any shift in our allocation strategy or adjustments or reinforcing provisions of the order like today. And so we will continue those, and we can ramp those up reflectively to make sure that our providers are well aware of our expectations. That is a fundamental purpose of this order as well, allowing us to set our expectations. The providers can then order reflective of those expectations and then deliver by complying with those expectations.
Well, if I could have a follow-up, there's also indications that our local hospitals here in Lancaster County have only been vaccinating their own, and that they've been turning away those that are in 1A to give preference to people who are working remotely. I mean, how would that be practically addressed?
So we're working on making sure that where there are provider allegations, where they haven't opened up to the full 1A class, that we really move forward on making sure that they know our expectation is that they can be scheduling for all of 1A. And so again, doubling down on those provider communications, reiterating our expectations will be where we will really make sure to focus next week, and so that they're well aware that they should be making and scheduling those appointments for the full 1A section of our Commonwealth.
Next up, Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, Alison and Lindsay. Earlier this week, Lindsay said the Commonwealth still thinks it's a realistic goal to have vaccinations open to the general public by the summer. But why should Pennsylvanians have faith that that is realistic when we haven't heard any specific timeline for how quickly we're going to get all the people in 1A vaccinated, a timeline for moving to 1B, or really any specific changes to the current vaccine system aside from these new rules, which seem to kind of be enforcing what providers already should have been doing?
Sure, I'll start, and then Lindsay, if you want to chime in. So we cannot forget that the limiting factor is our supply of vaccine. And with that, we are working really closely with our federal counterparts to understand real time what they see coming down the pike by way of increased production, new vaccines coming to market. Any way that we're going to try and increase that amount coming to Pennsylvania, we have been lockstep with them in trying to use their numbers and to put into our forecasting. And so to be able to have that close relationship with the federal government and have such communication is really helping to inform our forecasting, which is probably what Lindsay was basing her thoughts on as well, but I will let her speak for herself.
Yes, I absolutely agree with Secretary Beam, and I think that also we're enhancing all of our partnerships, even down to the local level. So again, as we talk about implementing a tool like Your Turn, we're continuing to have conversations about how we might partner with our sister agencies and local community partners to be able to get vaccine to folks who need it most.
And to follow up on that, I understand completely that the supply from the federal government is limited right now, but you mentioned these plans being progressive, particularly in terms of reducing the number of vaccine providers to 200 to 300 a week. But with that limited supply, I mean, isn't time of the essence here? Why not do this immediately? Can you provide any specific timeline for how long it will take for these most effective vaccine providers to see an increase in their doses?
Sure. So the timeline is happening now. The data reporting is being explicitly established now and reaffirmed now. And that data is going to help inform all of the contingencies and the characteristics on which those provider allocations will be built. And so, again, we want to make sure that our provider partners are abundantly clear in our expectations and then allow them next week's orders to reflect and really digest what those expectations are. We want them to order what they can use. We want them to be able to order what they can put into arms. And so by clearly stating our expectations, we'll allow them to adjust their orders accordingly for next week and have enforcement the following week.
Our last question today is Megan from CBS 21. Megan, go ahead and unmute.
Okay, thank you so much for taking my question today. We're having lots of conversations in our newsroom about how far behind Pennsylvania seems compared to other states. the percent of people that we have vaccinated is low compared to lots of other states. And in Ohio, we see teachers getting vaccinated. Do you have an explanation for this? Why is this happening? You know, we also see where they're mass vaccinating people at fairgrounds or other, you know, at other states where you just drive up. You don't even need to make an appointment. It seems like Pennsylvania is making it very difficult on people, and it's not working. What is your response to that?
So we are likewise concerned with where Pennsylvania is on those lists. As the governor has said, we need to do better. Pennsylvanians demand better of us, and we will do better. That's what's today's action, is really a plan for communicating how we are going to adjust our strategy and pivot at the critical time in this crisis to allow us to hone in on providers that can bring the urgency, use the vaccine as quickly as possible. Down the line, we will absolutely be building out towards convenience and making sure our provider network is fully used to the extent that providers want to participate. But that is the action that we are taking today to establish a pivot and improve upon Pennsylvania's ranking.